Fillers don't last forever, and that's actually a good thing. Because if you wanted to see how a filler in a particular area is going to look on your face and it would be permanent, then it might not end up being the best decision. So sometimes patients come to me asking for rhinoplasty, but they are not sure whether the surgery is going to look good on them. In those cases, we offer them fillers because they can make a informed decision after getting the fillers done whether they like their new nose or not. Similarly, sometimes people say that I want to get fat grafting in the lips, but I tell them that firstly, fat will not be able to give you exactly the same structure as a filler, and secondly, it is permanent. So you might not end up liking what you get. Fillers in the lip are the best way to get a lip augmentation without looking overtly puffy. And also, since it is a temporary measure, you can always tweak the results later on once the filler goes away. And in this way, you can really understand what kind of lips are going to look good on you. Therefore, having fillers being a temporary solution is sometimes a good idea because you can later on change these procedures of fillers into something more permanent, like let's say fat grafting or rhinoplasty or even a facelift or a fat grafting to the cheek surgery once you are sure what kind of results you like on your own face.